Good morning, all. The topic for today's discussion is tarnish and corrosion. The contents include definition, introduction, causes of tarnish and corrosion, factors affecting corrosion, classification of corrosion, chemical corrosion, electrochemical corrosion, evaluation of tarnish and corrosion resistance, protection against corrosion, and conclusion. As an introduction, metals are used in dentistry in various forms. They are used as metallic restorative materials in the mouth, as various instruments to be used in the oral cavity, as numerous tools and equipment associated with clinical and laboratory work. All metals used in dentistry undergo tarnish and corrosion, the percentage of corrosion varying from metal to metal. So coming to definition of tarnish and corrosion, tarnish, as we can see from the diagram, is a surface discoloration on a metal or as a slight loss or alteration of the surface finish or luster. The outermost surface layer of many semi-reactive metals such as copper, brass, silver, and aluminium undergo a chemical reaction forming a thin layer known as tarnish. This is a surface phenomenon that is self-limiting, unlike rust. It is mainly caused by chemicals in the air such as sulfur dioxide. Tarnish is manifested as a dull gray or black film or coat over the metal surface. Coming to corrosion, the definition is it is not a surface discoloration but actual deterioration of a metal by reaction with the environment. As we all know, the mouth is moist, warm, salty, acidic, and is continually subjected to fluctuations in temperature. The food and liquid that we take have a wide range of pH, and all these environmental factors contribute to the degradation of the metals used in the oral cavity. Corrosion is a chemical or electrochemical process wherein a metal is attacked by natural agents, resulting in its partial or complete dissolution or deterioration. Example is rust, the most familiar example of corrosion. It differs from tarnish in that it is not merely a surface deposit but an actual deterioration of the metal due to a reaction with the environment. Coming to cause of corrosion, tarnish is often the forerunner of corrosion. Water, oxygen, and chlorine ion present in the saliva contribute to corrosion. Various acidic solutions such as phosphoric acid, acetic, and lactic acid, often present in the oral cavity at proper concentrations and pH, can promote corrosion. The example include eggs which contain high amount of sulfur, various sulfides such as hydrogen or ammonium sulfide corrode silver, copper, and mercury. Coming to factors affecting corrosion, the microstructural phases and the surface condition of the metal, the chemical composition of the surrounding medium, temperature, movement or circulation of the medium in contact with the metal surface, the distance between the anode and the cathode sides, presence of a protective layer of oxides or any coatings, the nature and solubility of the corrosion products. Coming to the classification of corrosion, corrosion can be broadly classified under two headings, chemical or dry corrosion, and the next one is electrochemical or wet corrosion. Electrochemical or wet corrosion can again be divided under three subheadings, which include galvanic corrosion, stress corrosion, and concentration cell or crevice corrosion. Coming to the detailed description, galvanic corrosion can be caused by dissimilar metals and heterogeneous surface composition, and concentration cell or crevice corrosion can be divided under two headings again. They include the electrolytes concentration cell corrosion and oxygen concentration cell corrosion. Coming to chemical or dry corrosion, in chemical corrosion, there is a direct reaction between the metallic and non-metallic elements to yield a chemical compound through process such as oxidation, halogenation, or sulfurization, the absence of water or any other fluid electrolyte. So here the electrolytes are absent, and this type of corrosion is less susceptible to occur in the mouth as mouth is always warm and moist. Coming to electrochemical corrosion, electrochemical corrosion occurs in the presence of a fluid electrolyte such as water, and hence it is known as a wet corrosion. Only this type of corrosion occurs in the oral cavity where the electrolyte is the saliva. Here in the picture we can see that there is a saliva act as the electrolyte between the two restorations. One is silver amalgam which acts as the anode, and the other one is a gold crown which acts as the cathode. So the process of electrochemical corrosion, the electrochemical corrosion needs an electrochemical cell, and this electrochemical cell, as we can see in the picture, is made up of three main components. It's an anode, cathode, and an electrolyte. The anode, as we all know, it is surface of sites on a surface where the positive ions are formed. Anode undergo an oxidation reaction with the production of free electrons. Thus, the metal surface corrodes due to the loss of electrons. And cathode, the free electrons that are released by the anodic site are taken up by the cathode or the cathodic sites, where a reduction reaction occurs. Electrolyte is the medium that carries the ion away from the anode, and these ions are taken up by the cathode. It also carries away the corrosion product formed at the anode. The pathway of transfer of electrons from the anode to the cathode forms the external circuit that serves as a conduction path. Metal with lower electrode potential has a greater tendency to give away electrons and undergo oxidation. Thus, the metal with the lower electrode potential becomes the anode and undergo oxidation, while the other metal with the higher electrode potential act as cathode and take up the electrons. Coming to galvanic corrosion or the electrogalvanism, this type of electrochemical corrosion occurs when two or more dissimilar metals are in direct physical contact with each other. Example, it can be either two adjacent or opposing restorations made of different alloys. Here, saliva acts as the electrolyte. Galvanic shock, it is a pain sensation caused by the electrical current generated by contact between two dissimilar metals forming a galvanic cell in oral environment. Patient may also experience pain by touching the tine of a silver fork to a gold foil or inlay restoration. Here also we can see that there is a gold filling and an amalgam filling, which when comes in direct contact with each other can produce a galvanic shock. Examples, two different restorations in direct contact, an amalgam restoration which acts as the anode placed directly in contact with a gold restoration which act as the cathode, and this causes a short circuit which will result in the sharp pain experienced by the patient. The second example is two different restorations not in direct contact. When the dissimilar restorations are not in direct contact, an electrical circuit associated with the difference in potential or electromotive force between the two restorations still exists. The saliva form the electrolyte and the hard and soft tissue form the external circuit. Two different electrolytes. This can also cause electrogalvanism. Current may be present even in a single isolated metallic restoration. In this situation, the electrochemical cell is generated as a result of the electrical potential differences created by two electrolytes, saliva and the tissue fluid. Here, the tissue fluid indicate the dentinal fluid, soft tissue fluid or blood, and that completes the external circuit. The next one is heterogeneous surface composition. Another type of galvanic corrosion is associated with heterogeneous surface composition of a single surface of dental alloy restoration. A typical situation may arise when a metal surface has both anodic and cathodic regions on the same surface. Two reactions occur at randomly distributed sites on the metal surface. More frequently, there are anodic areas where the metal dissolves and cathodic area where other ions are discharged. The other major category is stress corrosion. Stress corrosion is a complex form of corrosion that occurs when brittle crack develop in irregularities such as notches and pit due to combined effect of tensile stress. It can be either bending or stretching stress, and corrosive medium is necessary for this. So the mechanical stress along with the corrosive environment produces the stress corrosion. During mastication, restorations are subjected to heavy compressive, shear, and bending forces. Also, burnishing of surfaces sometimes they result in localized deformation. Thus, an electrolytic cell is formed between the stressed and unstressed metal portion as stressed area become anode while the unstressed area become cathode. Examples for stress corrosion include clinical failure of rubber dam clamp due to their continuous usage, clinical fracture of removable partial denture frameworks upon their insertion and removal. Localized permanent deformation can occur in some part of the alloy when an alloy is burnished, beaten, or bent by cold working. It can result in corrosion where the deformed part becomes an anode to the rest of the alloy. Hence, it is advised against excessive burnishing of the margins of metallic restorations. Concentration cell or crevice corrosion. This type of corrosion occurs when a liquid corrosive or an electrolyte is trapped in narrow gap between metals or between metals and non-metals. A homogeneous metal or alloy can undergo electrolytic corrosion when there is a difference in electrolyte concentration across the specimen. The examples is a metallic restoration which is partly covered by food debris will differ from that of saliva, and this can contribute to the corrosion of the restoration. Here we can see that a clean surface has a higher oxygen potential which acts as the cathodic side, and the plaque buildup which can be having a lower electrodic potential, or the oxygen potential can act as the anodic side. And the electrolyte concentration cell corrosion, it can occur by accumulation of food debris in the interproximal area between the teeth, particularly if the oral hygiene is poor. This debris then produces an electrolyte in that area which is different from the electrolyte that is produced by normal saliva at the occlusal surface. Electrochemical corrosion of the alloy surface underneath the layer of food debris will take place in this situation, and the diagram clearly depicts this type of corrosion. Coming to oxygen concentration cell corrosion, different part of the same restoration can have difference in oxygen concentration owing to the anatomy of the restoration. Plaque accumulation in the crevices of the restoration may result in lower oxygen concentration in these areas, which act as the anode and undergo corrosion. Greater corrosion occur in the part of the restoration having lower concentrations of oxygen. And if the irregularities, the pits and scratches on restoration should be present, and the plaque and mucin deposits or even food debris can accumulate in these pits. The region at the bottom of such a crevice has a much lower oxygen potential than that of the surface of the restoration. The alloy at the bottom of the pit becomes the anode, while the alloy surface around the rim of the pit acts as the cathode. Thus, metal ions from the anode go into solution and causing the pit to deepen. Moreover, since the anodic region is much smaller than that of the cathodic region, there is a rapid transfer of ions in order to obtain a balance of charge transport in both regions. Hence, this type of corrosion can be very aggressive in a short period of time. This is the reason why all metallic restorations must be polished. Effects of corrosion. Noble metals resist corrosion because their electromotive force is positive when compared to any other metal used in the oral environment. To protect an alloy from corrosion, alloys used in dentistry should have at least half the component as noble metals, which include gold, palladium, and platinum. Gold resists the sulfate tarnishing as well. Palladium is found to be effective and resistant to silver alloys due to sulfate tarnishing. Coming to base metal alloys, they are resistant to tarnishing. Much of the corrosion resistance of the base metal alloy is due to the development of a thin, tough, adherent layer of oxide. This layer prevents the penetration of corrosive ions into the underlying metal and reduces electrochemical behavior to a passive state. Stainless steel. The corrosion resistance of stainless steel is attributed to the presence of chromium in the alloy, and approximately a percentage of 11 is needed to produce corrosion resistance in pure iron. Chromium resists corrosion well because of the formation of a strongly adherent coating of oxide on the surface, which prevents further reaction with the metal below the surface. And this formation of such an oxide layer is called passivation. Corrosion of amalgam. Low copper amalgam has much lower resistance to tarnish and corrosion as compared to high copper amalgam due to the formation of gamma 2 phase, which has least resistance to corrosion. It has been found that phosphate buffer solution inhibit the corrosion process. Hence, it can be said that saliva may provide some protection to dental amalgam from corrosion. Amalgam restorations are subject to tarnish and corrosion in the oral environment. It has been suggested that the corrosion process, although detrimental in some respect, it may also have some beneficial effects. Wagner has credited the corrosion process with sealing of leaky margins and mechanical anchoring of the restoration to cavity wall by deposition of the corrosion product. Coming to evaluation of tarnish and corrosion resistance, certain tests are available there. They include the sodium sulfide immersion test, clinical studies, potential dynamic polarization test, electrochemical impedance spectroscopy, linear sweep voltammetry, and electrochemical noise. The protection against tarnish and corrosion. The first one is passivation. It is a method by which certain metals develop a thin, adherent, highly protective film when they react with the environment. Such metals are known as passive metals. Examples include thin coatings of electrolytic zirconium oxide, which is deposited on cobalt chromium alloy, reduced chromium release levels in artificial saliva as compared to uncoated cobalt chromium alloys. Passivation can be done by electroplating. Electroplating is the application of electrolytic cells in which a thin layer of metal is deposited onto an electrically conductive surface. This process used in electroplating is called electrodeposition. Boris Jacobi, a Russian scientist, developed electroplating. Reasons for electroplating: it is causes corrosion resistance and to improve the appearance and value of the items and to increase the thickness of an item. Gold coating. This procedure is mainly done for commercial non-dental product. Since gold is a soft metal, its surface becomes easily scratched or pitted, exposing the underlying base metal to the environment. And this results in the formation of concentration cells between two dissimilar metals which are in direct contact. And formation of titanium oxide film, it has a passivating effect upon titanium. Increasing noble metal content. Since noble metals have higher electromotive potential, that is positive when compared to any other of the metal used in the oral environment, they can be added to alloys to reduce corrosion. Polishing restoration. A highly polished surface does not have any irregularities on the surface of the restoration, which may result in concentration cell corrosion. Avoiding dissimilar metal restoration. Galvanic corrosion is maximum when two dissimilar metals are in contact. In situations where there is such a contact, another non-conductive film or paint can be applied over the noble metal, which is more noble. This will result in a lesser surface area of the more active metal and thus reducing the process of corrosion. And the other one include the maintenance of oral hygiene and patient review. Calling the patient back for regular evaluations help to determine the accumulation of tarnish and deterioration of the restoration due to corrosion. Use of Mahler's index for this evaluation helps a lot. And on conclusion, though corrosion is almost always undesirable, there are some instances where it is beneficial, such as around the margins of dental amalgam restoration, as it seals a marginal gap. It is difficult to prevent corrosion completely in oral cavity. Hence, the selection of restorative material and good oral hygiene helps in minimizing corrosion process. Thank you.